Health specialists have emphasized the imperatives of community engagement as key to the achievement of universal health coverage (UHC) in Nigeria. A senior health specialist said this at the 2021 Abuja Summit on Community and Universal Health Coverage with theme Universal Health Coverage by 2030, driving the agenda with community at the center. The health specialist decried the low performance of Nigeria, stressing that the country was still at less than 5%, 20 years after the launch of the National Health Insurance Scheme, NHIS.
When you design health interventions, one, there must be engagement and you must empower people and communities. You must engage, you must empower people and community. So if you are going to achieve universal health coverage, going by the framework of UHC suggested, people must be engaged, people must be involved. If you look at it from 1999 to date, how many years? That's about 22 years. In the about 22 years or 20 years that NHIS has operated, from a study that was done, published in BMC Journal, just January this year, it shows that though it was launched long ago, 22 years or 20 years ago, coverage is still just less than 5%. Less than 5%. And 70% of those who pay still do out of pocket.
Similarly, Dr. Ahmed Danfulani, Director, FCT Health Insurance Scheme, said engagement with traditional rulers, religious leaders and youths was paramount to achieve universal health coverage. Danfulani, who commended the Nigerian network of religious leaders living with or personally affected by HIV/AIDS, 9RELA Plus, organizers of the summit, said religious leaders were sacrosanct in the efforts to mold policies and attitudes of their followers.
The traditional ruler, they are the judges, they are the tax collector, they are the mediator, they are virtually everything in the community. Therefore, there is no way you can enter such community without adequate clearance from the traditional rulers. So the importance of these people in Nigeria is very, very key, and in most African countries. If you want to get the masses into any program, not only health insurance, the traditional rulers are very key. Apart from them doing it directly, they can also bring every other member of the community on board to achieve a very robust, inclusion of their various community. Religious leaders in Africa, they are sacrosanct because a lot of the followers believe in their trust, believe in whatever they tell them. They are the guiding light of that community. Any group of actions in any community without the without the religious leader is not likely going to succeed. In FCT Health Insurance, in collaboration with 9RELA, we're already talking with different religious groups to help us mobilize their members and to come and register under health insurance.
Earlier, the national coordinator of 9RELA Plus expressed gratitude to the stakeholders who honored their invitation. She reiterated the commitment of the group to create awareness on universal health coverage to enable people know their health rights.
On behalf of the board and the management of 9RELA Nigeria, I want to appreciate our partners, Christian Aid Nigeria, UK Nigeria, and the FCT Health Insurance Scheme, who shared in our vision and joined hands with us to build agencies for communities, particularly the vulnerable people who are at risk of being left behind. Let me also appreciate our speakers, our keynote speakers, and all our speakers that are here today who have accepted to offer their knowledge, their time, and voices in commitment to our pursuit of community-centered universal health coverage. In achieving universal health coverage, it means that the citizen must be part of the system that is designed to improve their access to quality health services without suffering financial hardship.